Hey everybody, I'm joined here today with Dr. Katerina Tomenko over at Tomenko Family Dentistry. You can find them at tomenkofamilydentistry.com. And so we're here to talk about their treatments for snoring and improving sleep, along with some of the common questions that patients usually have. So doctor, thanks so much for joining us today. Really appreciate it.
Of course. Hello, everybody.
Yeah, and yeah, I wanted to just start off by asking about your experience working with these patients and what got you, into these treatments and being able to help them with this.
Of course. So we've been doing, we started focusing more on the preventative, and we realized that snoring can be a window to much deeper issues. And it's a sign of something that's more complicated. And so uh, that's how we started getting into the sleep apnea treatment, and specifically snoring is just as being one sign of it. It's a lot of people have it as a comorbidity. We always talk to patients about what they can do to treat it.
Mhm. Yeah, definitely. And I know for a lot of patients, they might not realize, how much of an impact that's actually making, in their own lives, and also if they're snoring, on their partner's lives. Is there kind of some other issues that they usually see, like, that arise with sleep deprivation?
There's so many things that when you start talking about sleep deprivations, it affects your life so significantly. We're talking about depression, we're talking about anxiety, we're talking about stress. It makes all of those things worse. Also, because snoring is being all sleep apnea, a lot of patients who have sleep apnea, they also experiencing high blood pressure, diabetes, and then you're at high risk of a lot of cardiovascular issues. So I know we're talking about snoring specifically, but it opens a window to many other issues. So if somebody has a mild case, if you're young and you start having hypertension and you're snoring, it's a really good time to do like a sleep test or something like that to make sure you don't have a deeper issue, because your high blood pressure is just going to go higher, and medicating it is one way of um, really not getting to the top, to the bottom of what's called, and sleep apnea is usually the underlying issue for it.
Yeah, absolutely. Yeah, and I know it can be difficult to really connect those sometimes because, obviously when you're sleeping, you're kind of in and out of it. And so you might not realize, how much of an impact that's actually having.
Yes, and how much of an impact it's having on you, and how much of an impact it's having on your partner. Because sometimes we hear patients come in with their spouses, and the spouse is that I'm the one who's concerned. He stops breathing, he's snoring, and then I can't sleep because he's not sleeping well.
Mhm.
Or she. It's actually works both ways.
Yeah, absolutely. And so if somebody is snoring, does that pretty much always correlate directly to having sleep apnea?
Not always, but often, more often than that it is. And so there's more papers coming with evidence. If you snore and you've been snoring your whole life, there's higher risk of memory issues, more deeper issues when you're older. And so I think it's always a good idea, if you're snoring significantly, it's always a good idea to look into it.
Yeah, definitely. And so what are really some of the main treatments, modalities that you focus on, with your practice in regards to snoring and fixing those issues?
So it's always a good idea to know what we're dealing with. If a person just says, oh, I'm snoring and my sleep is not really good, we'll start talking more about, well, how many hours, where is a person getting? If it's simply they're not getting enough hours of sleep and they're snoring lightly, that's one thing. But if they're trying to get as many hours as possible, 8, 9 hours, and they're still feeling groggy and they're snoring, we always talk about getting a sleep test. So we want to know what we're dealing with. And when the sleep test comes back, more often than not, it's a deeper issue, it's a sleep apnea. Or if it's not, we're dealing with options of dealing just with the with the snoring. And some of the treatments that we're looking into is we have laser therapy for the soft tissue, which simply what it does, it remodels the collagen fibers and tightening it up. And It's a pretty simple procedure. And the second one is the oral appliance therapy, where it creates more room, keeps the tongue out of the way, and just creates more room for the airway. So there's no uh, obstruction, partial or complete obstruction of the air.
Hmm. And so with the laser therapy, is that something that's, able to be done in the office? And how long does that usually take to perform?
Laser therapy, it's if you start looking laser therapy for snoring online, a lot of things will come in, and more of an old school laser therapy can come in, where ENT actually go into surgical procedures and they cut the soft tissue, and the recovery from it is pretty painful and gnarly. Now with the new technology, it's an office procedure. People come into our office, and with a topical spray, they may feel a little bit of a warm heat coming through the topical. It's a simple procedure, and afterwards they get a little bit of a scratch. So the recovery drastically different, very, very different. And also you can start, it requires a couple of treatments, 2 to 3 treatments optimally, with 21 days apart. So we want to give some time for the collagen tissues to remodel.
Mm.
And it's kind of stimulating your body to remodel and tighten and open that airway.
Sure. Yeah, that makes sense. And how much of an improvement and kind of results can patients typically expect with doing that treatment?
That's a great question. As with a lot of treatment, it depends on the person.
Mm.
How much dealing with, and how much tissue is one, and second, how flaccid or pliable the tissue is itself. Some people feel a difference right away. I had a mother who brought her 18-year-old, and they could hear him from a second floor snoring at night. And they went away for a weekend to New York, and she said she had to check on him 2 days after the procedure. Was he alive? Because he was quiet. So it really works. And some people, they need a couple of weeks, sometimes 2 or 3 procedures to really feel the difference right away, that drastic of a difference.
Right. And so is there anything that determines if somebody's a better candidate for the laser therapy over the oral appliance, or is it really just personal preference for them?
That's a good question. It's not a personal preference, because we need to determine, well, how much tissue are we dealing with, and the oral lens therapy mainly deals with the position of the tongue. Laser therapy of the soft tissue. If the person has been snoring for a long time, and that tissue has been stretched out so much, but it's been stretched out because of the tongue obstruction, we need to do both. We need to keep the tongue out of the way, and we need to help that tissue to shrink a little bit. But if the person's just starting to snore a little bit, they don't have, or laser therapy will be just enough, and we don't need to worry about the oral appliance. But a lot of the times when patients come to our place, they've been snoring for a while, and the snoring got so bad that somebody made them come in. And at that point, combination therapy usually works the best.
Yeah, yeah, I can imagine. And is there, with doing the laser therapy, is there any side effects with doing that? Or I'd imagine maybe just a little bit of a sore throat with that?
Besides soreness, and it's more of a scratchy throat. I mean, I had it done myself, and I just felt kind of scratchy at the end of the day, and that was it. Indications for it. So it's and a worst case scenario, if the tissue is thin, like for a person who has allergies and the tissues are irritated already, sometimes I may postpone, or if they have a cold and they already have sore throat, I would postpone the treatment. Not necessarily it's a contraindication, but maybe contraindication at that point.
Right.
And so if the tissue is a little thin, then they may get a sore or a couple of sores, but that's why we kind of determine, like, is now a good time, or maybe let's come back in a couple of weeks if you feel like you're fighting something.
Yeah, yeah, that makes sense. And after they do those initial treatments, and they start, to see relief, if they start to, develop the snoring again, can they come back and have the treatment redone, or kind of continue that process?
Absolutely. So that's the nice thing about this laser treatment. When the tissue is tightened up, after a while, especially as we get older, our tissue, the elasticity is not the same and it can stretch out again, and we can help with using the laser therapy again, and we can repeat it. And the research shows that so far, you would want to get treatments 21 days apart,
Mhm.
and then 18, 24 months later. That seems like to be the idea that's what would work for most people, if that makes sense.
Yeah. And do you need to repeat all 3 sessions again, or can you just do, 1 or 2, just depending on how much it's come back?
It actually depends on the person.
Mm.
So 1, 2 afterwards seems like to be the magic number.
Yeah, yeah, that makes sense. And for patients that are really ready to kind of tackle this problem and have a consultation, what would be the best way for them to get in contact with you?
We actually have a separate, besides Tomenko Family Dentistry, we have Advanced Sleep Treatment company. Either it's Tomenko Family Dentistry or Advanced Sleep Treatment. You go on the website and you can make an appointment yourself, or you can call the office. Either way works really well.
Okay, perfect. And yeah, those were the questions that I had for you. Was there any, last advice or anything you wanted to leave the patients with if they're struggling with the snoring and not sure what to do?
So if you don't know, what to do, please call us. We have amazing support staff. Step of the way when we work with the company. We don't do sleep tests, but we work with wonderful companies who do. And the process now is so simple. And sometimes people don't even want to explore because they think, oh, I don't want CPAP, I don't want mask on my face. There are options, and that's what's nice about it. Options. Please don't hesitate to call, because it just can make such a big difference in your life. I would just encourage you to call.
Yeah, absolutely. I think that's great advice. All right. Well, awesome. Well, thank you so much for taking the time to talk with us today and share the education on those treatments. I really appreciate it.
Thank you so much. I appreciate your time.
Yeah, of course.